Welcome to Space Uncensored, the podcast where we explore the intersection of space, science, and innovation. I am your host, Andrea, and today I am really excited because I have the pleasure to welcome Dr. Rosirene Gessinger, one of the pioneer figures in aerospace medicine, joining me from Brazil. Imagine, we have a really long time distance. Dr. Gessinger is the president of the Brazilian Society of Aerospace Medicine, which is pretty impressive. The Aerospace Medical Lead at InnovaSpace, and also a researcher at the Space and Extreme Environment Research Center at the Federal University of Health Science of Porto Alegre. Did I pronounce it right, Rosirene? You know, my Portuguese
Porto
is really
Alegre,
bad.
Porto Alegre. No, Porto Alegre, but it's quite good.
Okay, Porto Alegre. Maybe I get some couple of lessons
Perfect.
in Portuguese, right? I think the one thing I can say is domo obrigado. I think that's
It's
okay.
okay. It's okay.
Okay, perfect. So, Rosirene has more than 30 years experience in the healthcare and aviation sector, and she has made remarkable contribution to the field from working as an aviation physician for major Brazilian airlines. But now she's focusing on a research on how lunar and Mars hypogravity environment will affect human health. And I can't wait when we do a little bit of deep dive. So what really truly inspired me about Dr. Gessinger is her ability to bridge the extensive medical knowledge she has with her passion for space exploration. Because I think, especially when you are a doctor, you probably don't think that this is something in combination. And her research into suborbital flights, space motion sickness, and the role of traditional doctors in aviation and space industry is shaping really the future of how we understand our human body operates in an extreme environment. So today, we will explore her journey, the emerging fields of space medicine, and how we prepare for the next generation on the challenges of space travel, which I'm really curious because I do want to go to space. So maybe you are finding the solution so that I'm not getting sick. So without further ado, let me welcome you on our show. Welcome to Space Uncensored. It's such a great pleasure to have you here.
Hi, it's a pleasure to be here today. And first, I'd like to thank you, Andrea, for the opportunity to share my experience with the listeners of Space Uncensored.
Awesome. So I want to go a little bit into background because I'm sure that the listeners are really curious with your background, which is really diverse from aviation medicine, as I said, to research of space health. Can you take us and share us a little bit of your journey? How did you got into aerospace medicine field? How did that story begin?
Well, it all started during my undergraduate studies when I joined a research group on barotrauma in divers. That got me interested in how pressure changes affect the body, which led me to specialize in otolaryngology and eventually otology. In the early years 2000, I began working as an ENT for Varig. That was a Brazilian's leading airline at the time. The company unfortunately shut down operations in 2005. 2007. But I continue working and specializing in aviation medicine. Understanding the impact of flying environment on human physiology, which become the focus of my career as a medical doctor and research.
So you spent more than 20 years now in the aviation medicine and working with top Brazilian airlines. What is it about aviation medicine that really drew you, and how does it differ from traditional medicine?
Well, what initially drew me into aviation medicine was the unique opportunity to combine my love for flying, I really love flying, with the chance to explore how the flying environment impacts the human body. When I started my career, there wasn't much research in this area, mainly because air travel wasn't as frequent as it is today. And with commercial aviation becoming economically more accessible, flying went skyrocketing. When you ask me how aviation medicine differs from traditional medicine, I'd say it differs really a lot. Many people and some doctors don't realize is that is flying completely different compared with traveling by car or ship. The impact of the flying environment is totally different on human body. Inside the cabin of an aircraft, even though it's pressurized, it's not pressurized to sea level. When flying, we find ourselves in a hypobaric environment where low oxygen levels demand body adaptation. For most health people, most health passengers, the body adjusts quite well. But for those who with certain medical conditions, especially respiratory and heart issues, it can be much harder, and sometimes leading into in-flight emergencies. Sorry, that's the main difference, and why I believe it's so important to include aerospace medicine in medical training.
I think this is really an interesting intersection of that. And it brings me to the next question, which is about your PhD research, which I am really fascinated by, because your research, which you're working on right now, is on effects of the lunar and hypogravity environments on us as humans, right? And it's truly fascinating because what you just described, I don't think that, flying became such a common thing to do for many people that you don't even realize the impact on our health. And now if we want to go to low orbit or beyond, what are the impacts? So can you maybe explain to our listeners, what is the difference between hypogravity and microgravity? And why did you decide to focus on hypogravity in your research?
Yeah, well, for convention, on Earth, we have 1G, one gravitational force. And the term microgravity refers to the condition in which people or objects appear to be weightless. Sometimes microgravity is called zero gravity, but it isn't correct. It's incorrect because zero gravity does not exist. Microgravity is the closest you can get to zero gravity. And for example, people in suborbital flights, in parabolic flights, and in ISS, the International Space Station, experience microgravity. And the term hypogravity is the gravitational force lower than that found on Earth, but it's not as low as microgravity. For example, we find hypogravity in the Moon and Mars. So far, only 12 men experienced the real hypogravity, the 12 astronauts who walked on the Moon. On face of that, my research is in hypogravity. Very little is known about hypogravity. We have more about microgravity. And now the growing investments for the return to the Moon as an Artemis project and missions to Mars sparked my curiosity about the fit-to-fly assessment for future passengers, the space tourist. Nowadays, there's a demand for knowing how we can make this travel safer and more enjoyable for ordinary space travelers.
I think this is something really, fascinating because, and I think I use the word fascinating too often today, but I think this is just an incredible area to talk about, because when we talk about going to Moon or going to Mars or just going to a low orbit, you look at it from a traveler perspective, but that how our bodies adjust and these disciplines in medical research, which are necessary to actually enable the travel, are incredible. So let's talk about space motion sickness a little bit. This is a really area of it's an intense area of your work, right? So with the rise
Yes.
of the commercial flights, and you talked about it a little bit, how do you see the space tourists need to be prepared for effects of a space motion sickness? And I know you compared it when we spoke before, you compared it like you go get sick in the car and nobody wants to be, get sick on when you go on into a space flight. So can you elaborate a little bit? As I mentioned, how do you see the space tourists need to prepare for the effects of the space motion sickness, and what is being done to address this?
Well, extremely necessary to be prepared because one of the most common effects is the space motion sickness, which can provoke dizziness and vomiting. It's not a really enjoyable thing. Can you imagine someone paying a real fortune for flying to space and not enjoying the journey? The effects caused by space motion sickness. Along my career, treating airline crew workers, I acquired a lot of knowledge about flying effects on people, and that gave me the insights to start my research on hypogravity. There's a little being done to understand the effects of hypogravity on human body and how it can be treated in order to make the space flying experience more enjoyable. We have using technology aids like VR and hypogravity simulators to help us to investigate the physiological changes on human body.
We spoke quite a lot about the research work, and I think one area which struck me that it's really amazing that late in your career you decided to return to research and to pursue a PhD in aerospace medicine. Many people think, you should do it when you are in your 20s or your 30s, right? What advice would you give to anybody else who is looking to explore new fields, no matter at the, what stage in their life they are?
Well, I really think that there's no limit for learning and starting something new. Whether it's picking up a new skill, exploring a new passion, taking a step forward, grow, exploring new fields can be exciting and rewarding. Some of the adventures are curiosity, fulfillment, personal growth, career development, and in an ever changing world, we can keep open to learning. I think that's life enriching.
Yeah, I think you are a real inspiration for not only women, but anybody who wants to go into a different field and different industry. And in the previous answer, you touched a little bit on virtual reality and artificial intelligence, right? And I think that as someone so deeply involved in health research, how do you see virtual reality and AI playing a role in advancing this field?
Well, I think that both are essential, completely essential for the development of space health research. VR and AI help simulate and understand environments that we haven't been yet. For this, I think that is essential.
And it's in many other industries, they obviously use VR and AR and artificial intelligence for simulating work of robots or agriculture. And I think it's many people probably didn't think that you can use the same technology to apply it in an area of health. And you emphasize, I always digest what you said. And in one of the areas which you mentioned is that you really emphasize that there is no limit to learning, right? And we spoke about the different areas which you do, and you mentioned curiosity and that it doesn't matter in what stage in your life you are, right? What made you actually decide to go back to study, and what has been the most magical part of your journey so far?
Well, I've always been a very curious person. I love venturing and learning new things. So one day I got this invitation for my PhD from my friend and former university tutor, Professor Thais Russoman, who is a Brazilian trailblazer in space research. And going back to university as a student, it was something very, very nice for me, establish new connections, set new horizon, make it possible to enjoy new victories, enjoy new progress.
You mentioned before that the traditional doctors may face challenging transitioning into space medicine, right? What do you think it's needed for the traditional doctors to prepare them for this emerging field, and how can we train more doctors to be ready for the unique environments of space aviation, aviation and space, obviously, because there's aviation and then it's going to space. And obviously these are two different fields, interconnected, but two different. So what are your thoughts around how do we need to prepare the doctors for the future of the different type of travel?
Number one is to be up to date to new technologies and be willing to venture into new fields. I think that is more important. And medical school programs must include aerospace medicine in their curriculum. And universities should foster more research groups in this area.
So if anybody from any university is listening to us right now, please make sure that
yes,
you
please.
include it in your curriculum. And I actually 100% agree with you because there is very little taught about space tech, space medicine, space exploration. It's a little bit about planetary system but it's such a massive opportunity for students, for learners. We spoke about the suborbital flights, and they really becoming a reality. I mean, yes, they are still very expensive, so only a certain number of people can afford it. But with any technology, the evolution, and I'm sure that the cost will go down. So how do you think we can ensure that the public is adequately prepared, besides of having obviously deep pockets to be able to afford it? How do we need to prepare ourselves as human beings for these new experiences in space?
Well, that question, this is actually what drew me into my PhD studies. Unfortunately, we haven't got the answer yet, but this question really motivated me to return to studies,
So maybe once you finish your PhD, you come back and you will
yes.
tell us all about it, right? So that we can then put it on our checklist and say, this is what we need to do to be able then to travel to space.
I hope so.
No, I hope so too, because I do want to go to space. I think it must be absolutely magical, even to go to low orbit. I personally would love to go on the balloon of Space Perspective. I think what they're doing, it's absolutely amazing, and maybe beyond. You are currently president of a Brazilian Society of Aerospace Medicine, and I'm sure many people are super curious and would like you to tell us about the work the association does and how does it help to develop and promote space medicine in Brazil.
Yes, our mission is exactly show and inform medical players the importance of space medicine for people health and safety. We promote meetings, conference, and study groups to address the issues related to space medicine in Brazil.
You are really accomplished so much in your field, and I'm curious to know, how do you maintain, your mental and physical well-being while juggling? I don't think balancing is the right word. Juggling such a demanding career. Do you have any routines or activities which really keeps you grounded and keeps you in control of all of these different areas, your brain, your soul, your body?
Well, I try, but I practice gym every day and keep a social life, meeting friends, sometimes traveling. I love discover new places, new cultures, new people.
Uh, I go to gym as well. I think this is, I wish that would be another subject at school that they would teach actually to children the power of weightlifting and less sugar. And because it seems that we discover it so much later in our life while
Exactly.
we made so much of damage to our bodies. Meditation, right? I think that should be like mandatory subjects, like meditate every day at school, at least for 20 minutes, everyday sport at school for at least 1 hour, then learn about space, and
Exactly.
then anything else. Exactly, right? Um, with everything what you have on your plate, I always ask my guests if they have any books or resources that they turn on, for inspiration or growth, both professionally and personally. Any recommendations from your side?
Yeah, now do my research and job, most of my sources of inspirations are found online. But I also seek for inspiration and grow in my travels. I love travel and know new things, new places.
Uh, it's interesting, but some one of my favorite authors is Tim Ferriss, and everywhere he goes, he tries to learn the language. I didn't master that yet. I think that's super ambition, but I think that's another level of curiosity, right?
Yeah.
Uh, I think one of my questions as well, you've been a trailblazer in the medicine, and you are a woman, you went into study really late. The area which you study, it's super specific and super impactful because it will hopefully allow people like myself to go to space without being sick. Now, what is your vision for the future of space medicine, and how do you see it transforming healthcare, not only in space, but also on Earth?
Well, really think that space medicine will become everyday medicine. Innovations in space medicine will help improve healthcare for all people. The knowledge and technologies developed for space medicine have the potential to transform healthcare. For example, telemedicine systems
Mm-hmm.
perfected for use in space can enhance access to healthcare in remote or underserved regions, and
Mm-hmm.
AI-driven health monitoring systems and compact portable diagnostical device designed
Mm-hmm.
for spacecraft can become invaluable tools to resource limit settings.
Hmm. I think this is a really great ending on a high. So, Dr. Gessinger, thank you so very much. This was a really great and fast travel to space with you. Thank you for sharing your journey, the insights. I feel so educated after having spoken to you about microgravity and lunar gravity, and all of these forces. It's like a university when I'm speaking to people like yourself. So thank you for spending the time. I believe truly that your work is paving the future for generation of space healthcare professionals. You are the first person which I actually met in that area. I'm sure there are many, but for people who are not in that space industry, really deeply, it's fascinating. And I do hope that it will be soon introduced as a subject in universities as well. And I'm sure that our listeners will really leap with deeper understanding of the importance of space medicine. It was an absolute pleasure to have you with me today on Space Uncensored.
Ah, I hope this talk be inspiring and motivating for anyone willing to venture into fields related to space healthcare. And it was really an honor to be part of Space Uncensored as a speaker. Thank you, Andrea.
Thank you so much. And to the dear audience, this was another exciting episode from Space Uncensored. Please tune in to the next one. In underneath the post, you can see the LinkedIn profile and all the contacts for Dr. Gessinger. If you want to contact her, obviously feel free to do so. And I'm looking forward for you to tune in next time. Thank you very much.